So the branches that are coming from this is subclavian artery. Okay, subclavian artery. Subclavian artery is the one that is coming from the arch of aorta on the left side, and it is coming from the bifurcation of the common carotid bifurcation of the brachiocephalic trunk on the right side, and directly from the arch of aorta on the left side. This breakage, this bifurcation is happening behind the sternoclavicular joint, and so let's see. So it comes out when it originates, it is divided into three parts on the basis of this muscle, anterior scalenus muscle. On the basis of anterior scalenus muscle, it is divided into three parts. The part that is medial to it will be the first, behind, second, lateral, third. So there are branches. So these are the parts. Let's talk about their. There is no name of the parts, and the relation with the scalene and the anterior and starting and ending points. Let's talk about the starting point, ending point, and the termination point. I just talked about the starting point. It starts from the point where it bifurcates on the right side and where it originates from the arch of aorta on the left side. It does not have an anatomical landmark, anatomical ending point. We have on a base of level, we have defined it. Just this is the first step. This is the lower margin of the first step. Just as it crosses the lower margin of the first step, this is the point where we stop calling it subclavian, we start calling it axillary. When we are studying the upper limb, we discussed that axillary artery was starting from the later margin of the first step. So that is the same definition that goes to the ending point of the subclavian artery. So this is it. It has three parts. It is starting from it. It is ending here. It has three parts, and we have discussed multiple times now that it is behind the scalene anterior. I discussed with you in a previous lecture also the relation with the scalene anterior is very commonly asked. So a question can come like artery is anterior to the scalenus medius, artery is posterior to the scalenus anterior. Scalenus anterior is between the subclavian artery and subclavian vein. Subclavian vein, it passes in front of this. And these relations, especially the subclavian veins and subclavian artery relation, which of them is lying anterior and posterior, and what is the relation with subclavian anterior. This becomes important clinically because subclavian vein is another one of the major veins that is cannulated for major venous access. Okay, enough about the parts, its relation with the scalenus and origin and termination. Let's talk about the branches that are originating from here. The branches. The branches that are originating from here are the one is the important one that you have studied in the thorax region, that is one that is going down into the thorax, that is the internal thoracic artery. The internal thoracic artery that is going down, it will go down in front, in just behind the costocartilages, just later to the sternum, and it will go down up to the diaphragm, and at that level it will break into musculophrenic and superior epigastric, and that's a whole discussion there, but let's keep it here that internal thoracic artery comes from here. The second artery that is, actually I should have mentioned it as the first, that goes upwards, that is known as vertebral artery. Vertebral artery goes up here. You can see it goes up. Just focus. Let me get the arteries first, then we will discuss them one by one. And the third artery that is rising here, that is this thyrocervical trunk, that is known as thyrocervical trunk. So these are the arteries that are originating from the subclavian trunk. So let's talk about them one by one. Internal thoracic artery I won't be discussing in much detail, but let me give you a very brief preview of the internal thoracic artery. It originates and it goes down behind the costal cartilages, moves down parallel and lateral to the sternum, and it will go down supplying the anterior intercostal arteries, supplying the anterior perforating branches, and it will go down to the sixth space, and then it will bifurcate into musculophrenic and superior epigastric artery. And this is the artery that is having the internal memory group of lymph nodes along with it, and it is the artery that is used for the coronary bypass surgery. you break the artery free from the lower end and you attach it to the coronary artery distal to the blockage. Enough about internal thoracic artery. Let's talk about vertebral artery. Let's first just talk about its route. Vertebral artery is the one that moves up, and this is the artery that occupies the foramen transversarium of C1 to C6. Just get a focus here. It is not passing through. It is not passing through C7. So it will move up through the foramina of the C6, 5, 4, 3, 2, 1, and you can see the transverse process of forum 1 is on the lateral, so it will do a curve right here, and this curve becomes important radiologically. When you are looking at angiograms, you see this curve going, and after the curve it will dip inside along the arch of the atlas, and it will move between the occipital bone above and arch below, arch of atlas below, and it will move into the foramen magnum, and it will go into the brain. And in the brain, in the cranium basically, in the cranial cavity, it will move on to the anterior aspect of the medulla oblongata, both them, and they will join at the upper margin of the medulla oblongata to form the basilar artery. And then the whole discussion goes, what are the branches of the basilar artery and how the basilar artery ends by breaking into the posterior cerebral arteries. There's a whole discussion of the cerebral circulation. But one thing that comes back to the head and neck is that this vertebral artery, it gives rise to two branches that unite in the midline to form the anterior spinal artery. It moves in the vertebral column with the spine on the anterior aspect, and there are separate posterior cerebral arteries that are moving on the back aspect of the spinal cord. So this is about vertebral artery, its branches. But these are not the only branches. In the neck, it has a lot of branches also, but they are not very bigger one and individualistic. They are very small branches supplying a lot of things. So there are meningeal branches that goes through these foramina, intervertebral foramina, to go into the meninges of the spinal cord. It has posterior, and it will have anterior and posterior spinal arteries that will go and supplement. It will have radicular arteries that will go and supplement in the posterior spinal arteries. We just discussed the anterior posterior spinal arteries coming from down, and it will have branches in the brainstem. So these are most of the branches that are discussed in the brainstem. I'm trying not to go there, but it will supply the muscles here, it will supply the meninges here, it will supply the spinal cord as well. It will go along. Then there is this thyrocervical trunk. Thyrocervical trunk, it's the one, by the name you can see, thyrocervical trunk is going to supply the thyroid gland, and it will going to supply the cervical region, the neck region. It goes up thoracocervical trunk, and it gives two branches on the lateral aspect. There is suprascapular artery. It will move back and go and move above the superior margin of the scapula on the suprascapular notch. It will move above the suprascapular ligament. That's a discussion for upper limb. The anastomosis around scapula, if you have in mind. Then there is transverse cervical artery. It moves laterally and it goes and supplies the lateral aspect of the neck. Okay, let me move to the 3D model. Let me set it up. Okay, so let's try to follow all these structures here. I will have to add them one by one. I hope so. You can stay with me during this. Okay, let's add internal thoracic artery. Okay, let me do a little. Let me do the other parts of the subclavian artery also. Then we will do them in block. So subclavian artery, I talked about the three first part. First part had three branches: internal thoracic, a vertebral, and the thoracocervical trunk. It has further three branches: inferior thyroid arteries, superficial cervical artery, and suprascapular arteries. Then the branch that arises behind the second part, that behind the scalenus anterior muscle. that is called costocervical trunk. That is called costocervical trunk. It rises just behind the scalene anterior and it goes back over the root of the lung. It goes back over the root of the lung, costocervical trunk, and it gives rise to two branches. And when it goes back, one branch moves down, one branch moves up on the back aspect of the neck. The one branch that moves up on the back aspect of the neck is this one, the deep cervical artery. It moves up and it supplies the muscles of the back of the neck. And the one part that goes down on the back aspect, this is called highest or supreme intercostal artery. You may have a little memory of it from the thoracic region when we studied that the first two branches, the first two thoracic arteries and posterior intercostal arteries are coming from the superior intercostal arteries. Then there is a third part. Third part usually does not have a branch, that it may or may not have a branch, and that branch is called dorsal scapular artery. Dorsal scapular artery. Okay. Let's take a 2 minute break here. Well, let's take a more break here. Let's take a 5 minutes break here. Stretch your legs. Think other things. I will come back after 5 minutes, inshallah, and I will set up meanwhile the 3D model. Will re-go through this topic, and then we will move on to the venous structures. There is one controversy regarding the dorsal scapular artery and deep cervical artery. We will discuss it then, inshallah. Start from where we left off. Okay, let me, before jumping into the next topic, let me give a little detail. Let me, okay, let me just do one thing. Okay, let me switch to the model. Let's quickly revise what we just studied about the three parts of the subclavian trunk and the branches and all that. First, we discussed the internal thoracic artery. I thought I just, okay, we are ready. Let's go. So, this is the part of the subclavian artery, the part that is behind on the medial aspect, the part that is behind, and the part that is lateral. And it is ending at the upper margin, lateral margin of the first rib. So let's look at the, I have labeled all the pictures on the left side. So let's look at the branches. So the first branch that is going to the anterior aspect, that is the internal thoracic artery. This is the branch, the internal thoracic artery that moves back. Let's back out a little and then look at the ascending branch. This is the vertebral artery. It's a little difficult to see it with the muscles on. Let's fit this structure. Let's, okay. So now I think it would be better visible here. This is the vertebral artery. So it is going here. You can see it through the scalene anterior. It is going through the vertebral canals. Here you see it is not passing through the last foramen. It is moving 3, 6, 5, 4, 3, 2, 1 all the way to the top. And you top in the, if you follow it to the top, it makes a loop, outside loop here. It goes outside to go into the transverse foramen, transverse cerium. Then it moves behind the atlanto-occipital joint, and it moves in the posterior arch of the axis, and here it is entering into the foramen magnum. It is entering into the foramen magnum. Here it will join to the vertebral vein on its opposite side and form the basilar vein. So this is the vertebral vein for you. It has the meningeal branches, spinal branches, and all that. Let's look at the other structures that were coming from here. We had this branch. This is thyrocervical trunk. Itself, it's a very small, maybe a centimeter or a little more, and it has a very important branch that goes above. On the above, that is the inferior thyroid artery. It is like a loop. It goes up and goes medially behind the thyroid gland, and medially it has very important relation. It moves behind the common carotid artery. This is the common carotid artery. So it moves behind the common carotid artery, and you will read the name of this artery when talking about the posterior relation of carotid sheath and posterior relation of carotid arteries. It moves behind it, and it goes like a loop, and it goes into the lower lobe of the thyroid gland. Then there are two arteries. Okay, here, this is the one that goes to the top of the scapula. This is the one that goes here, and it moves just above the suprasternal notch. And this is the one you read about in the anastomosis around scapula. This is that artery. It moves, and then there is this artery that is transverse cervical artery. It again moves laterally on the upper part of the thoracic cage, rib cage, and it does not this one, this one, this one. This is the one that is moved above it and goes to the back aspect. And this is the artery that you again read about in the thoracic cage. It moves, winds around, or sometimes through the scalenus muscle. It moves under the latissimus, the levator scapulae, and it goes all the way down, and it gives rise to this artery, dorsal scapular. Let me talk about this controversy also. Okay. Now you have seen written here the superficial cervical artery and the suprascapular artery, and here you are seeing the transverse cervical artery and no superficial cervical artery. So there is a discrepancy. It rises and it causes a lot of confusion when people who have read different books discuss this topic with one another. Normally, what happens is that, let me get my notes little here. Normally, what happens is that through the thyrocervical trunk, there arises, let me here, let's do thyrocervical trunk, and from it there arise inferior thyroid. It goes like this, and there arise suprascapular, and there arise transverse cervical. Simple. And that was a subclavian artery. This was the subclavian artery. Okay, so this is happening. The transverse cervical, as it goes to the back, it usually divides into two branches. It has a superficial branch, and it has a deep branch. Deep branch is the one which which form the dorsal scapular artery. It forms the dorsal scapular artery. Please forgive my writings. And this one goes to the back of the scapula. But there is a variation. Sometimes what happens is that there is subclavian artery, there is thyrocervical trunk, there is inferior thyroid artery, and there is suprascapular artery. Okay, but one thing that happens is the dorsal scapular artery arises independently from the third part. First part, second part, third part. Dorsal scapular sometimes arises independent in the third part. When it arises independently in the third part, the branch that was coming from here, it does not have to now divide to form two things. It does not have to give the deep branch now. It only has to give the superficial branch now. It only has to give the superficial branch now. When it gives a superficial branch now, you don't have to name it the transverse. It is totally named as a superficial cervical artery. So that is why when talking about the branches of the thyrocervical trunk, you may get two different views. These two are solid, inferior thyroid and suprascapular, but you may give the third one of these two. In some books, there is transverse cervical. In some books, there is, sorry, not this, there is superficial cervical. So here is where the controversy lies. And the reason behind it, and in the books where you will read superficial cervical, you will read the dorsal scapular is the branch of third part. And in the books where you read the transverse cervical, you will read that the third part of subclavian artery don't have any branches. So that's it. And here you can follow the same thing. This is the picture. The text is from the Snell anatomy. The Snell anatomy has written superficial cervical artery, and it has written that there are no branches in the third part of the subclavian artery. And here is a picture from the grays, and the same situation is made in the graph, that there is the transverse cervical artery, it goes to the superficial, and there is dorsal scapular artery. So that is the situation that is shown in this model right here. So that is the situation that is made in this situation here, that you can see here the dorsal scapular artery, it's originating independently from the third part. See subclavian artery, the last part, the third part, and here you can see the originating dorsal scapular artery. And because it's originating dorsal scapular artery, you will see it moving on the middle aspect of the scapula. And here you can see this artery, this is independent. This is will be known as transverse cervical artery, or here it will be known as superficial cervical artery, because it does not have to go and make the deep branch. It does not have to give origin to the deep branch. So this is about the branches of the subclavian artery. Let's talk about the veins. So here is a picture of the, okay, here is the picture for the, let me get to the ahead of it. Okay, here is the picture that is summarizing all of these things. Okay, the relation vertebral artery and all that. There's a net